Hello there! Welcome to Let's Talk Research. I'm Dr. Charity Marsh, the Director of the Humanities Research Institute, or the HRI, at the University of Regina. Let's Talk Research is produced in Treaty 4 lands, and the University of Regina is situated on Treaty 4 lands with a presence in Treaty 6. These are the territories of the Nehiyawak, Anishinaabeg, Dakota, Lakota, and Nakota, and the homeland of the Métis Michif Nation. Let's Talk Research is a podcast focusing on the diverse, innovative, and critical research that is supported by the HRI. Joining me for today's show is Dr. Vivian Puplampu, who is an associate professor in the Faculty of Nursing at the University of Regina. We're going to be talking about her research, which focuses on older adults' living environments, aging, and ideas of place and home. Originally from Ghana, West Africa, Vivian came to Canada in 2002 to begin her graduate studies at the University of Alberta. After completing her master's, she went back to Ghana, taught and worked there, and then she returned to the University of Alberta to complete her PhD. In 2016, she began working as an assistant professor at the University of Regina and currently works at the Saskatoon campus. I began our conversation by asking Vivian to tell us about the areas of research she specializes in.
Thank you very much, Dr. Marsh. I'm Vivian Puplampu. Now, regarding what I do, I'm a registered nurse. When I was doing my PhD from 2009 to 2015, I did the registration in Canada as international educated nurse. So I got my RN in 2011, and I work as a registered nurse in Edmonton in many long-term care facilities. So this is how I got into research on older adults. So I work with older adults in long-term care facilities in Edmonton for more than 5 years. And so working in that area, I developed unique interests with older adult population, even though my PhD and my educational background was on teaching, nursing education. So I focused more since I started the assistant professor position on older adult population, but I've also been doing research on nursing education. So my first research on older adults, I did it in Saskatoon on older adults living in co-housing environment. And this will lead to my story of why the project that I did for the HR during the pandemic.
At this point in our conversation, I wanted to make sure that I understood the difference between co-housing and long-term care. So I asked Vivian to explain.
So my first research was on co-housing and how it supports older adults, their quality of life. It's a co-housing community in Saskatoon. That's the first senior co-housing in Canada. So the people there were all older adults. The youngest person was 50 years old then. And so I look at that research and I was very, very happy and personally loved the living arrangement there because the participants were very, very satisfied with their life. The fact that they have autonomy, control, and they decide and they have input in how they will run their living environment arrangement, So that kind of started my interest in housing for older adults because again, and this is from experience. I've worked in long-term care as registered nurse for over 5 years, and I've had experiences, not one, not two, many, whereby my residents don't want to be there. And they are crying, take me out. I don't want to be here. So that has always been on my mind that, okay, is there something that could be done? Is there another living arrangement where older adults here in Canada, and I'm saying Canada, could have a say or could live where they are happy, where they want to be? And I never found an answer until I came to Saskatoon and was introduced to co-housing and did this project. And I will go there because they do have days that sometimes they will have potluck, sometimes they will invite a musician to come and play for them. So they will contact me, my contact person, they will say, we are having this program, come and see how it goes, because it was part of my research to learn more about that housing arrangement. And I'll go and I'll see how they are so happy, the other adults are very happy. And so I thought, this is very nice, and I need to spread the research out on this kind of living arrangement. So that started my first research on older adults. It's on co-housing.
During the early months of COVID, long-term care facilities for senior were really in the spotlight, as Vivian has explained. The impact of the virus and the protocols put in place to keep older adults safe, the concern around exposure, and the need to isolate, these were all felt strongly in these facilities. This is such an incredible research project, and I wanted to know a lot more. So I asked, what were you seeing or hearing that made you want to turn your research eye to older adults? What was happening to them during the pandemic? What did this study look like? Who did she interview? How many people? And what were their ages?
Okay, so now I'm moving to the study that I did during the pandemic, and which was funded by the Humanity Research Institute. And I'm very thankful for this funding to be able to do the research. So having given the background of older adults living environments, at least I pick co-housing and long-term care. We also have older adults who live in their private homes, in individual homes in the community. And then we have those who live in assisted living. So assisted living helps older adults who need a little bit help with laundry, housekeeping, but they can still independently live without much supervision. They can cook their food. So for this project, what I did was to look at 3 housing arrangements and find out to explore, because it was qualitative study, I wanted to explore participants' perception on their healthy aging during the pandemic. So the living arrangement that I looked at or I worked with in this study were co-housing, assisted living, and then private homes. So I wanted to look at how these living arrangements or environments influence older adult healthy aging in place during the pandemic. As we are all aware, there was a spotlight on older adults, then long-term care facilities during the pandemic. And as I watched the television at that time, I kept asking myself, do people also know about other living arrangements that are out there, and not make it feel like long-term care is the only place older adults can live? Because it was creating an impression, one, long-term care is not a good place because of the outbreak that was occurring there. And 2, I felt like the message that we're getting was, this is the only living arrangement for the adults, and this place is not helping. All we hear was death rates, and it's occurring in this long-term care, it's occurring in that long-term care, it's occurring in that long-term care. So I wasn't hearing positive things, and I got worried because 1, I've worked in long-term care. 2, I've done research in another older adult living environment that isn't long-term care. So I wanted to know what is happening in other living environment. I contacted the directors in this organization because I work with them in my research. And so we formed an advisory group. The director of care from the assisted living joined me. That was Luther Care Communities in Saskatoon. I got a board member from Saskatoon Council on Aging because they will help me to get to older adults from private homes. And then I got one of the leaders from a co-housing community. This one was in Regina. And so we formed the advisory group, and then we started the project.
Engaging in research like this during COVID is very complex. And so one of the things that I really wanted to understand was how did she as a researcher converse with the people that she was trying to engage in this project? There were so many different regulations and safety protocols. How did she connect with these participants, with these people?
Yes, thank you very much, Dr. March. So I talked to older adults. After the ethics approval, I sent the posters on the project to the various organizations or facilities on the advisory board. So the contact people shared it with their members. For instance, as Cartoon Council on Aging, advertising their e-news, Luther Care communities, they had assisted living and long-term care. So we focus on the assisted living because the ethics part for the long-term care was very complicated. It was going to take longer time to get the approval. So we focus on assisted living. That one, we could go through the ethics as we went easily. So they shared it with their residents and those who were willing to participate. They got their names. Because it was pandemic time, all the interviews were done on the phone and they were between the ages of 65 and 90 years. But I like to go back to the idea of policymakers and how the long-term care was managed. I believe there was a lot of things unveiling in terms of how things are done, and comments were made about how older adults' care should be looked at, and especially their housing should be given attention, and also make sure that they are being taken care of, And so that was a key thing. But I think in addressing this, as they were focusing on the policymakers, I believe the agency of the older adults were not really emphasized. And plus the fact that their caregivers were also a little bit not emphasized as well. But in older adult care, the older adult number one should be the one making the decision, and caregivers also help a lot, and they do have community like friends, that also help them, leaving their care in the hands of external people, like former caregivers do not help. Back to co-housing is very informal, but the quality of life they are getting, they're very good because the older adults are making decisions, they have input in it. Their children, their friends all have input. Like they are all keeping an eye on each other. So removing these people from the care of older adults would impact quality of life. And that's one of the things that this study came up with. So co-housing, assisted living, and private homes, the three groups that were involved, they were all happy. I'm moving on to the findings from the study. They were very happy about their healthy aging in place. And what is healthy aging in place? I'm going to kind of talk a little bit about that. So healthy aging in place is basically the older adults having the health, that's their personal composition, having the health, having social support and services from the community that will help them to live independently or continue to live in the community. So they have the help, they have the social support, they have the needed service from the community to be able to help them live well, either independently or to continue to live in the community. And that was what I was looking for in this project. Are they living well? Are they coping well from this living arrangement? Co-housing, private home, and assisted living. So if you look at these three living arrangements that I look at, the older adults have their autonomy, their independence, their, I would say, 100% involvement in decision making. So they were very happy. And so from the findings, they said that their healthy aging in place was very good during the pandemic. Why? Because they came out with, in addition to following the provincial requirements, each units came out with their own regulations on how they are going to take care of themselves. For example, those in assisted living, because that setting is a kind of formal semi-institution setting, there were rules, visitors couldn't come in, and a family member who would come in has to be checked, like temperature check, hand sanitizing done. And in the peak of the pandemic, that was when I collected data. So they would drop items that they were bringing for their loved ones or their family members at a point, and then the person will come and take it out. So because of all those regulations, the older adult first say, because at that time, no one had COVID in this residence. So they first said those who were living in their personal home, because it was their home, they made their own decision. They said, we stop outing or having contact with people. We stayed in our homes. Many of them were either living by themselves or with their spouses or with maybe one child, and they were ordering food or grocery, and it will be put in front of their house and they will go for it when the person goes. So they follow the regulations and even instituted their own personal regulations to take care of themselves. Similar thing with the co-housing arrangement. They used to have potluck together. They used to have some social activities together. They said they stopped all those things, And so with that, they were all happy, very satisfied that they could keep themselves safe. There was no even outbreak. So they were very happy, So that was one finding from it.
Although they were able to keep themselves safe. So on that level, there's like, a sensibility of one, pride, we're able to do this. We can keep ourselves safe. That kind of independence is so key, especially as one ages and the possibility of losing independence. And as you said, losing autonomy and agency within decision-making about oneself is so challenging. And just the impacts, the effects of that can be so huge. One of the things, though, even within this kind of living arrangement, is that sense of like there was still isolation. I mean, one of the things, and maybe did they talk about that though as something when they were talking about their quality of life, and in that sense of how did they manage that, or were they able to manage that a little bit differently because there was perhaps less? I'm thinking about, so often we heard with like larger institutions or long-term care homes where they were on lockdown for many, many, many weeks at a time, because there kept being cases, there kept being outbreaks. If that's not happening in these other situations to the same degree or in the same amount, perhaps the social they were maybe able to engage with each other differently. Or did they talk about this with you?
Yes, they talk about that a lot. That will be under the challenges of the pandemic. They did talk about that a lot. One of the challenges was reduced activities and access to service. So everyone was on isolation. And because the older adult population knew they were vulnerable, first of all, didn't want to go out, because this was done when the vaccine hadn't come. They didn't want to go out. So there was reduced activity by the social distancing regulation, plus the older adult themselves being careful not to expose themselves. So that reduced activity was a challenge. And then services were moved online. So there was also decreased access to services, and many older adults have one or two health challenges that they needed either to see their specialists, but they couldn't. They needed services to fix their homes, like those who lived in private home, personal homes. One of them said she needed a carpenter, but couldn't bring the person in. And the person didn't want to come because it was locked down. And so that reduced access to activities and services was a challenge. Then they really miss social interaction with family and friends. Even those who lived in less assisted living facility, whereby they had other older adults with them, because of the pandemic, they were not meeting in the big lunchroom. People were asked to stay in their rooms, and they would either eat in their rooms, or I think they had a rotation of maybe two people come at this time or that time. So they were not together. So they missed that. They missed their colleagues, their friends from their assisted living. The same thing, those in private homes and co-housing, they missed that social interaction. Then isolation, loneliness, and depression was another strong challenge of the pandemic, whereby the older adults felt very lonely, and especially those living in their private homes, because it's either the older adults alone, many of them, or they with their spouse or a child. So when they were on lockdown and they couldn't go out and wouldn't let people come in, because the older adults were very careful and their family members were also careful not to bring bugs to them, because some were working in service areas. So there was this, like, they were locked inside, and so the isolation was intense, and loneliness and depression. But the good thing with older adults is that they have resilience. I heard a lot about my older adults whereby they will say sometimes they will feel a little bit blue. Like, they don't use the word depression. They will say, we feel a little bit blue, but I will shake it off. And they use the phone. I think one of those things, coping strategy, was calling people to check on them. The internet and social media wasn't part of them when the pandemic started, but they started gradually getting into it, like Zoom. But it was a challenge. Like, during this interview, many of them could not come on Zoom or anything. They would say just telephone. Plus, the reason also I found that many of them were not on internet was that either the financial part of subscribing to internet or the technology using it. So many of them couldn't join Zoom, but they all had land number. So many of the interviews were done on land phone. So it tells us a little bit about our population during the pandemic. So that made it hard on them, the isolation, loneliness, and depression. Another thing is that they couldn't go for church services. I found that many of them, church was part of their life. And so not being able to go for church service was really hard for them. And some of them would say that even though I joined church service online, but it's not the same as in person. I think those in assisted living, there was no service organized there. They all moved online.
That idea of, like, the church, that sense of another loss of community, because of course, virtual you can see, but it's certainly any of those experiences, right? They're different. They're not what one is used to. And I think that notion of people, older adults, actually those that had not become very technologically savvy around being online and virtual presence. I know a lot of people dip their toes in a little bit to try and stay connected, and families trying to keep connected with each other. So here, I'll set this up. Just press this button and I did that even with my own parents, right? This sense of like, oh, let's all look at each other and be together in these ways because we are so far apart. I think that idea of talking about older adults as resilient is so key, because we often hear that language around children and youth, but we don't often hear that around older adults. And I think this is, even from your comments, and your research, this sort of sense of what the challenges that were overcome, and also the creativity with which they responded in order to, one, keep themselves safe, but also still somehow stay connected is a key part of that resilience. And that's a really lovely word to hear in relation to older generations, which I think it's so true. I mean, my work is grounded so often with youth, and that's a word that's often there with youth and children, but not necessarily with other ages. And so I really appreciate hearing that.
And I would say that is the resilience of the older adult that took them through this pandemic before the vaccine was discovered, because the picture that was going on in the media was like, there's no hope for older adult. But they kept telling me, I just turn the TV off, because when I listen to the TV, it disturbs. But I can tell you what, I've seen tougher things in life. I will take stock of what I'm thankful for. And sincerely, I heard that over and over and over. And that was what pushed them through, because the whole thing was like, older adults are dying. But the good news about it is that the housing arrangement that I used, the 3 housing, they were all doing very well. And they did well from their own initiative. They came out with redirections and we are going to follow it, and they will follow it like the co-housing community who didn't have formal decision maker or government leader saying, you do this, if you don't do this, this will happen. It's informal, but they made those regulations and they stuck to it and they look out for each other and they were all safe. Nobody had the virus. Those in their personal home, they made their own decision how to protect themselves, not to go into public places, follow the pandemic direction. They would do their grocery one at a time. Couples would designate one to do it, the one who doesn't have much comorbidity. So they came up, rallied up with their own way of handling the situation to protect themselves and not get the virus. So they didn't get the virus. I would like to see a picture to highlight the strength of the older adults during the pandemic, especially this community living older adults. They took up their own initiative, their own strength, their own agency to manage and stay healthy. And we can learn something from this in terms of moving it to long-term care.
For some of these situations, obviously, if someone is staying in their private home, it's either their home, they have family that they're living with, so that's one. But the accessing co-housing situations, how accessible is that? As long as one has their independence and their cognitive functioning, but how accessible is something like that?
It's very accessible, and one of the strength of co-housing is having neighbors and friends to step in when one needs help, especially when the family members are not there. And that's why older adults like co-housing, because many of them, their kids have moved out. They are not even living in the city or province there with them. And so when they get to the point whereby they need somebody to be checking on them, they need somebody to give them a ride for grocery because they are no more driving. They need somebody to do some motivating things with, like yoga. One of the co-housing where I did my initial research, they have a day that the women will get together and one of them knew how to teach yoga and they will do some yoga together. So all these services free of charge. Somebody is sick, they will cook for that person. They have a group email and they will just type their email. Vivian needs to go for doctor's appointment Monday, May 16. Can somebody give her a ride? Before you realize 2 people have responded, I'll give her a ride. So that is service that Vivian doesn't need to pay Uber for. A neighbor in that community, the building has given. So one of the strengths of co-housing is support. Social interaction is also another thing. They come out with different things to interact. And if somebody doesn't see you one day, they will call you. So they look out for each other. And at the same time, during the pandemic, they made regulations on how to protect each other so that they don't bring the virus in, knowing that they were all older adults and many of them have challenges.
The significance of living in community, to be connected to others. It's been documented and researched. This new way of living, this co-housing that Vivian's discussing, it supports independence and connection at the same time, and further assists with maintaining a good quality of life, good health, longevity.
I would like to highlight the fact that decision makers are making decisions about older adults. They need to consider a couple of things. Some of them are social interaction and autonomy of older adults. These are very key in promoting their quality of life. So the community style of living, as we talk about, is very prominent in co-housing. And one of the reasons why the people said they chose co-housing is because they want to be in a village style of a living environment whereby each person knows each other. That sense of belonging, that sense of home, of being among people who are like-minded, who you you feel at home with, and not the older adult feeling like I have nobody to interact with. So it tells that social interaction is very important. And when they did that during the pandemic, where older adults were cut off from their social contact, it's disturbing. So if we have to go somewhere, the social part of key family members, maybe one person, should be allowed to the older adult space environment. And then the other thing is the autonomy, the ability to make their own decision. Older adults don't like it when people are making decisions for them. They've made decisions. They've been young, working age, and older. And now just because they are old, trying to rip that from them is really one of the most traumatizing things one could do to an older adult. So let them make their own decision, So these are the two things that I would say. All the housing arrangement that I look at, they were all happy because they could make their own decisions. They decide who they would let into their house during the pandemic, who they wouldn't let in, where they would go and where they wouldn't go. And then other things followed as well. In terms of where I'm going with this research, I'm still continuing to work with older adult population. I want to look at their social connectedness. But this time around, I'm looking at racialized older adults, looking at their social connectedness and how the environment, their living environment, support that. Older adults thrive and do well and are happy when they can socialize. That socialization is not like being in a large crowd, but being in contact with people through diverse ways. It may be one or two in person, then social media. So the environment that supports them contributes to their healthy aging. So this is where I'm going now in terms of the research, how the living environment can support them. And I'm going to be advocating for autonomy of older adults, society recognizing them, giving it back to them. We shouldn't take it from them. And then promoting their social interaction and supporting them, which will help them age healthily and independently or stay as long as they want in the community.
Wow, congratulations. That's very exciting.
Thank you very much, Dr. Mash.
Let's Talk Research is produced by me, Dr. Charity Marsh, and I'm supported in this project by my savvy and creative colleague, Evie Johnny Ruddy, and our research assistants, JC Bells and Samantha Liamson. You can find Let's Talk Research on the HRI website or on your favorite podcasting platform. Thanks for listening.